Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
No, I am Dr. Paraneetharan. I am a lead neurosurgeon from Miyot Hospital, Chennai.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
The seizure is an abnormal electrical activity of the brain. Is may be provoked or unprovoked, creating abnormal movements of the body or absence of the body. It leads for seconds. It will really disturb the day-to-day activity of the person as well as the brain metabolism. It will be a chronic and a disabling disease if it is untreated.
What is epilepsy?
Epilepsy is a group of seizures. If it is continuously getting, then it will be called as an seizure, epilepsy.
What are the different types of seizures? And do they affect people differently?
So there will be a focal seizure or generalized seizure, sometimes complex partial seizure, absent seizure, myoclonic jerks. So there are so many types of seizure is there. So each one is representing the origin of the brain. So some seizure will come from the temporal lobe. They will present as a complex partial seizure. Some seizures coming from the frontal lobe, it will present as a adversive seizure. Some seizures coming from the motor strips, then it's called Jacksonian march of epilepsy. So it depends upon the location and the character and the intensity. So the names are of the epilepsies accordingly.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Any insult to the brain will cause irritation to the brain parenchyma or cortex. This is the active part of the brain. You used to call it as a neuron. So the neuron will go for a firing. So then firing will cause this type of epilepsy. So the insult will be a ischemic infarct or mechanical insult like a head injury, or there is any chemical insult like dehydrations or overall alcohol consumption or vitamin deficiency. Sometimes even scar also will produce seizures.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
So normally the patient will feel prodromal symptoms like a headache, some giddiness, some ringing of ears, tinnitus, vomiting sensations. Sometimes they will have a numbness in the hands. It will ascend upwards towards the shoulder. Sometimes the patient will have some dreamy effect like a deja vu or Jamayu phenomena. So these are the prodromal symptoms of seizures.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yes, so many of the myths are there about the epilepsy. The epilepsy is really a disease or a symptoms coming from the brain. It's not related to any religious or any other psychological issues related to the patients. So the epilepsy is not a continuous disease; it's a curable disease. So epilepsy have many kind of presentations, not only the tonic-clonic. So if the patient have a not having any tonic-clonic, we cannot say it as epilepsy is a myth. So even if you are absent seizure, the patient will not have any other tonic-clonic movement of their limbs. They will have blackouts and sitting in the ideal version. These are the symptoms of seizures. So there are so many myths are there. So these are the false belief about the seizures.
Got it, got it. And how does the stigma affect people with epilepsy?
Yes, the mainly thing is the patients suffering with the seizures automatically they will restrict the day-to-day activity Once their day-to-day activity is reduced, then the efficacy and the earning capacity will be come down. Then it will go for a poor income generation that will affect their social status. So it's a vicious cycle. So due to this economical downfall, they will stay again in the house. Again, they will go for the same cycle again and again. So it will cause a major social stigma.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
So mainly the patient should avoid four points. Mainly they should have adequate sleep. That means 8 hours uninterrupted sleeps. If they go for a 10 o'clock sleep means they will get up around 6 o'clock in the morning. So 8 hour uninterrupted sleep. First point. Second is they should not be in the empty stomach. Always they should have some amount of food in the stomach. That means they should avoid hungry. Third thing is
Yeah.
they should avoid the flickering lights like a cell phone usage, mobile phone usage, laptop
Mm-hmm.
usage, pubs, and other enjoyment with the over photic stimulations as well as audio disturbance that will also provoke seizures. Fourth thing is they should not go for emotional upsets like over crying, over laughing, stressing. Everything will leads to epilepsy. These are the four basic things everybody should avoid. Second thing is if they have any seizure symptoms, they should go for a proper checkup like a CT scan, EEG to rule out the localization and type of the seizure. Then the treatment, if you want to start early, then we have a early control of the seizure.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Lifestyle means so they should have a healthy lifestyle. They should have a very good habit of sleeping habit. Then they should avoid all the other neurotoxic drugs and other drugs like nicotine, alcohol. They should avoid that.
Mm-hmm.
The food aspect, they should have a healthy combination of carbohydrate, lipids, and proteins with micronutrients. So emotional balance also should be maintained to have a very good lifestyle.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yes, actually, the patient, whoever having seizure, they should carry the card. The card should mention as in they are the seizure patients, and then the back of the card they should have what are the drugs they are taking regularly for the seizure, and who is the consultant or which hospitals they are regularly attending. So, if the details if they carry in their handbag or in the pocket, it will be useful for any first aid reasons. Second thing is if any patients is feeling with the prodromal symptoms like headache or any other numbness like things, they should go for a safe places to avoid the sharp items or burning items or any machineries. So whoever having regular seizure, they should avoid driving, and that too in the night. So these are the safety precautions. They can avoid their injuries as well as the others injuries also.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course.
So there are so many drugs are available in the market. They should not take it as an counter drugs for any epilepsy procedures or epilepsy diseases. They should consult a neurologist properly to find out what is the type of the seizures. Then, if you start the proper treatment early, there will be early control and cure for this epilepsy.
Thank you, doctor. And thank you to our listeners. Until next time, take care and stay informed.